He's a licensed psychotherapist and neurotherapist. He's a licensed psychologist in both California and in Hawaii, a licensed mental health counselor in the state of Washington. He practices integrative trans-theoretical psychotherapy. He says his training is in multiple systems: psychodynamic, interpersonal, cognitive behavioral, EMDR, and exposure, emotionally focused, person-centered. He completed his PhD and MA in clinical psychology with a specialization in psychophysiology, earned an MBA. His clinical internship was completed at a private practice in Seattle. His published dissertation thesis was testing a novel theory he created that combined a stress management theory, which he'll talk about, with biofeedback, and he received the award of dissertation with distinction. He is board certified in neurofeedback and biofeedback and is trained in EMDR, eye movement desensitization and reprocessing. He's currently in the process of board certification for QEEG, quantitative database EEG interpretation, which is so useful both in assessment but also in treatment, in Q-guided neurotherapy. So with that, I'm going to ask Brian to go ahead.
All right. Can everybody hear me okay?
Yes.
Okay, good. Thanks, Don. Yeah, so thank you for inviting me to present this today. I'm I'm a little jet lagged, so I'm just gonna say that as a disclosure. I just got back from the Philippines from doing some scuba diving. So that's kind of what we're going to talk about a little bit today. And you've got my background. The dissertation that I completed at Saybrook called Integrated Stress Inoculation Training and Heart Rate Variability Biofeedback on Adult Recreational Scuba Divers in a Natural Diving Setting. It was a preliminary pre-post treatment quasi-experiment. So there was quasi meaning that there really wasn't a control group, but we did get good pre-post information from that. And then it's published on ProQuest, so it's a publicly viewed free document to go look at if anyone's interested in reading the thesis. Committee, Dr. Don Moss was on my committee. Bonnie Settlage was the chair of my committee, and Richard Sherman was also on my committee. So again, thank you all. That was extremely valuable to have those individuals participate and provide guidance and getting this completed and everything that was learned from it. So let's get into it. The diving world. So why did I pick a study on scuba diving? Well, being a scuba diver myself, I have been exposed to several people, quite a few people who actually almost, died scuba diving. And it was because of stress and panic. And so thought, well, is there something that we can do for people like that? But then even broader than that, can it be generalized to people in the clinical world who have extreme stress and panic? And is there an intervention or a treatment that would be possible for that? And so I started doing the literature review, looking back into it. I didn't see that there was really anything of much to talk about in terms of treatments, but there is a little bit of research that had been done in terms of what had been looked at for diving in the diving world and accidents and things like that. So the main triggers here are insufficient gas, being entrapped, equipment problems. What gets disabling is somebody does an emergency ascent because something's happened. They have insufficient air, gas. They have buoyancy problems. They get disabled. And so then there's asphyxia, there's gas embolisms, there's cardiac incidents, there's trauma, there's decompression sickness. There's unexplained loss of consciousness. There's all these different consequences that happen from somebody who has a dive accident or incident. So at the time, there were about 398,000 certified divers in the US. 19% of those had reported a diving incident due to anxiety or panic. And 19 to 40% of those were associated with some sort of a psychological issue. So what's hoped to be gained here? So the research was possibly to remediate with the psychophysiologic triggers behind the diver air supply problems and improve the overall experience of those participating in the sport. So, and the study outcomes may be, and we were hoping this would be true, is to generalize those to divers in everyday lives, but also maybe to see where that could become a clinical application. And, you know, the process of doing that hasn't really been tested or studied, but that is something that could be done in the future if someone was interested in doing that. The questions that were being answered, is there an applied psychophysiological intervention that may have a positive impact on scuba divers and those who are having difficulties with managing stress while diving, and in what form? And will the combination of a cognitive behavioral psychotherapeutic approach known as stress inoculation training, which is a well-known therapy approach for people who are in highly stressful situations, like in the military, for example, and combining that with a psychophysiological intervention known as heart rate variability biofeedback, could that help modulate the high anxiety and the stress in a recreational diver? And then the third question is, how does learning to overcome this high anxiety and stress in diving from an intervention in stress inoculation training and heart rate variability impact that individual's perceived self-efficacy? So I'm not going to go into the full lit review. There was quite an extensive one. This is one of the key components that came out of the literature review. And if you're interested in the lit review, it's in the dissertation and you can see that online. But one of the things that was found here is by these several studies that using the profile of mood states, it's a psychological instrument, that you could see how somebody who is panicking and see their profile compared to somebody who doesn't panic. We call this the iceberg profile, which is the no panic profile, where you see the big peak and the bigger facet of this type of a instrument. So the iceberg profile is the mood state, and the anger, confusion, depression, fatigue, tension, and vigor are the facets of this particular psychological instrument. You can measure people and have them take take the study or take the questionnaire, and then it will normalize the results of that for every individual. I use this quite a bit in my practice for people who are under a significant amount of stress and also have mood issues. High anxiety scores of 39 or higher on the state trait predicts the respiratory distress of hyperventilation and panic under stressful diving conditions. This was found by this particular study. So in consequence, I used these two things. I used the STAI for including people in the study to see where they might be panicking or anxious enough to actually be in the study, and also the profiled mood states, the POMS, to measure pre-post. So in conclusion, the diving industry is lacking in intervention and helping anxious or panicking scuba divers. There is an opportunity to contribute to the original research. And there are prior scuba diver psychological studies that were very old, but nothing published that combined stress inoculation training with heart rate variability biofeedback. And that was also conducted also in a real diving environment. So that was in the open water. And the lit review was reviewed from the present, which at the time was in, 2018 to 1970, searched all the databases pretty much everywhere. The working hypotheses. So the study was to look at participation in a 5 1-hour stress inoculation training session. This would be a therapy session, and integrate that with heart rate variability biofeedback to see if there is a cause and positive decrease in cardio-respiration measured with total air tank consumption in pounds per square inch, which is known as PSI, and then the average airflow in cubic feet of airflow per minute. So that's a good measure of how much somebody's breathing in underwater, and then their heart rate. The second hypothesis was to look at participation in the intervention and see if there's decreased anxiety, increased vigor, and a decreased mood disturbance while diving. And looked at, out of the 5 facets of the PALMS assessment, I looked at 3 of those, which was the total mood disturbance, the anxiety, and the vigor. And then the third hypothesis was participation in the intervention will cause a positive change in self-efficacy, as measured by another instrument called the Generalized Expectancy of Success Scale. All right, the method was a quasi-experimental single-group pre-post repeated measure study. We had 9 certified scuba divers participate, which was a challenge in itself. And we talked a little bit earlier about the challenge of getting participants. So that's definitely nothing to underestimate. The recruitment included ages of people who are 18 to 65. They had to be certified in open water diving and willing at the time to participate in all the training and test diving. The recruitment exclusion was anybody who had a STI score less than or equal to 34 was excluded. They need to have, if they had any health conditions, like tachycardia or any other kind of serious cardiorespiratory health condition, they were excluded. They needed, if they didn't agree to the informed consent, for the IRB and other ethical issues, then they were also excluded too. And then anybody I'd had a personal relationship, they were also excluded as well. So the setting was in the open water dive site. It's near Seattle, Washington. IRB approved it. Sampling instruments or physiological data from the respiration sample was collected by a device called a Scuba Pro Galileo Luna dive computer. So everybody had one of these computers. I purchased the computer and then I had everybody using it. And then it had an integrated heart rate monitor on it as well. So everybody was wearing a heart rate monitor band around their chest to measure their heart rate as they were scuba diving. And then the psychological data was from the profile mood states and from the generalized expectancy and success scale. In the independent variables were the stress inoculation training and the heart rate variability. And then the dependent variables were the total air consumption, average airflow, average heart rate, total mood disturbance, anxiety, vigor, and self-efficacy. And then the data analysis was testing for outliers, normality, paired t-tests, and Cohen's d for effect size. So the intervention stress inoculation therapy pretty much was developed by Donald Muckenbaum. And there's a process or a procedure to follow for that, and that was pretty much what I followed. That's a kind of a manualized treatment. And then heart rate variability biofeedback, mostly following Lair's approach to doing heart rate variability biofeedback, which is finding somebody's resonant frequency first and then practicing the resonant frequency that is determined for that individual over the course of 5 sessions. And then they did that at home, and they had to do that for 20 minutes twice a day. So this is the self-evaluation questionnaire for for the STAI, and then the POMS looks like this, and then the self-efficacy scale. You can see a picture of what the dive computer looks like. The people wear that on their wrist, and then there's a wireless connection to their scuba tank that then measures all the information about how much their airflow is. And then this is the heart rate monitor that goes on their chest. The HRV biofeedback was done with a ThoughtTech system, and using the distant respiration and the BVP sensor, and then ThoughtTech software. So what they did is they watched a movie of divers who were in distress, and then practiced their HRV and kept their HRV levels at the optimal levels so that they would not go into a distressed breathing state while they're watching somebody who is in a movie of somebody who is in distress. And then they kept the movie running at the same time. So interesting to watch that process. Okay, the results had 9 participants. 7 of them were female, 2 males. Average age was 23 with a standard deviation of 11. Water temperature, 54 degrees, not very warm. So, but people around here dive in cold water. And they did everyone had to do the 5 sessions. So the hypothesis 1 was, did the decrease in cardiorespiratory airflow happen? And it did. So we had a significant decrease in airflow from what people started with. And then after the intervention, went back and did the dive again. And then they showed that they actually had a pretty good decrease in airflow. So that's a good thing. That means they're breathing slower. And let's see here. Air consumption, big deal with scuba diving is you don't want to consume too much air too fast, or you'll run out. So it had a pretty significant decrease in air consumption. That was actually very significant, the D of 2.59. And heart rate decreased also significantly. So this is again pre-post. And then the psychological changes were also very significant, going from the total mood state increase. In this case, this would be an improvement. So they go from a thinking about scuba diving and being anxious about it, and then after the intervention, and then going and doing it again, and then feeling much better. Their anxiety level came significantly down. Their vigor level went up. So if somebody's less vigorous, meaning that they are a little bit hesitant, they are very hesitant to actually do the activity that they're doing. And if they have more vigor, then they're feeling more motivation, more drive, more ability to be able to do that. And they're feeling it's more vigor in that process. And self-efficacy went up. So that means that they had a psychological shift in how they went from, well, I'm not sure that this is a good thing for me. I'm not sure that scuba diving is the right thing for me. I'm not sure that I can survive this. Afterwards going, yeah, no, I can do that. This is definitely doable, and I feel like I'm going to be successful at it. So the results, the study positively identified several applied psychophysiological interventions to help scuba divers in terms of relaxing. It found that the interventions might help modulate the high stress in scuba divers. And it found that the intervention might help increase individual self-efficacy. So unfortunately didn't have a control group, so I couldn't say that it was that there was a level of efficacy in the intervention, but that's also something that could also be done in another follow-up study. In comparison of the findings to other studies, you can see that the top graph is the Ragland-Stegner study that was done in 2005 on scuba divers using the POMS. And you can look at their profile of what they found there, and then you can look at the profile of my study, and you can see that it's quite similar, although the anxious participants were higher in anxiety than the ones that were in the Raglan study. But that you can see the profile actually ended up being pretty much the same post-test. So you can see that they have that nice iceberg profile. There were delimitations and limitations, of course. The study could not be generalizable, but you could take the information from that and maybe use it in a clinical setting. Participants experienced only one type of intervention, didn't do several. My style might have influenced participants' reactions. The dive site was selected to control for environmental factors, but it wasn't a normal, typical open water dive site. It was in a fairly protected area that didn't have any current, and it had pretty good visibility. The diving time was shortened to a maximum of 40 minutes. Most dive times are usually 50 to 60 minutes. The study did not attempt to determine any learning effects. The study focused exclusively on anxiety and panic. And the warmer water diving climates might produce a different result. People might feel a little bit more relaxed and less stressed in a warmer environment. And there was no control group. And the size of the study was small, but the size of the study was large enough to actually be significant for the results. And the conclusions can't be made about anyone's gender or age differences. And the measuring the changes in mood and efficacy during the dive was also impractical. So in other words, while they're actually diving, measuring what they're feeling during that time. There are clinical implications. So the research results study indicate that the future results for mind-body stress mitigation interventions would be fruitful. Replicating the study would be suggested and worthwhile for sure. And extending the study's application to other populations would also be something to suggest that people do, or somebody do who's interested in this particular area of stress. And the study highlights the probability that highly stressed individuals can have a non-pharmacological treatment option. So this was all done through mind-body medicine, mind-body therapy, HRV, nothing pharmacological was used here. And the study indicates that scuba divers with high anxiety or panic can experience the lower levels of the symptoms, longer dive times, and greater safety and increased self-efficacy.